Warnings of the fourth wave continue to mount with concerns of possible stricter lockdown measures ahead. How can we prevent a devastating fourth wave? Dr. Kerrigan McCarthy, specialist pathologist at the National Institute for Communicable Diseases, joins me now. Dr. McCarthy, good evening, and thank you very much for your time and joining us. Assessing the effectiveness of the non-pharmaceutical interventions up to this far to mitigate the spread of COVID-19, what does it inform us about how we should respond in the future as far as the limiting of social interaction? Dr. McCarthy?
So, thanks for that question. Non-pharmaceutical interventions are effective. Non-pharmaceutical interventions are effective, and there's emerging evidence to support that. Some lovely studies where they investigated transmission between cases and contacts showed that mask wearing reduces transmission risk to about 7%. Which is a fantastic achievement and gives us great reassurance that certainly mask wearing is important. The other intervention that has been shown to be effective is reducing the size of gatherings, the number of people at gatherings, and particularly indoor gatherings. So increased ventilation is effective in reducing the risk of transmission in indoor spaces.
Yeah. And how do you validate then that kind of approach? I mean, people would be probably more than happy to continue with the non-pharmaceutical protocols. I hope you can hear me there. I'm saying if we continue with the non-pharmaceutical protocols, people are likely to be more than happy with that as opposed to a stricter lockdown. So how do you validate those findings so that it makes sense to a would-be skeptic to say, no, we do need some degree of limitations in public gatherings?
Look, it is a difficult question to respond to. There are many competing priorities. First and foremost, we are social creatures. Human society thrives on being together, being connected, being part of, and non-pharmaceutical interventions, mask wearing, limiting the size of gatherings, does stand in the way of that. Harsher lockdown measures obviously have immense economic impact, particularly over festive season, on tourism and travel. So the government is really tasked with balancing the needs of people in all aspects. So the NICD can really only speak to the health side of the equation. It's up to our leaders to, social perspective, mental health issues are important to consider, while at least encouraging us in one way or another to continue implementing non-pharmaceutical interventions.
Yeah. Using the country's then specific numbers, the local context, such as the timing of the adoption of the vaccines, and so on and so forth, and in the absence of course, a wider spread or penetration is the word they use of the vaccines. What are the options that we have? I mean, previously we would say that, well, because we do not have vaccines and therefore the only solution we have now is to lock down the country and lock down the economy so that we delay, is the word they use, the spread of the virus in the population.
I think globally the world is realizing the devastating impact of lockdowns on society and on human individuals in particular. And I think governments across the world will be very cautious in calling for lockdowns. I think we'll never again see a complete lockdown as we saw in March 2020. But at the same time, there does need to be due response and recognition by members of society about the severity of risk. When we wear masks and when we maintain our social distance, when we increase ventilation, we're not just doing it for ourselves, we're doing it for the broader society. if I get infected, I could pass the infection on to any number of other people. But if I observe non-pharmaceutical interventions, such as wearing masks and social distancing, I can protect my loved ones. Of course, vaccination remains the most effective intervention in reducing the risk of transmission. And of course, we've seen globally and in South Africa, particularly amongst healthcare workers, we've seen evidence that vaccination reduces the need for hospitalization, the need for ICU beds, and the number of deaths due to COVID. So in terms of protecting our loved ones, we do best to protect ourselves first. And many of us are breadwinners. We are responsible for the livelihoods of others. We have people who love us and would be devastated if we were to die. Our consistent and continuing advice to persons is to consider vaccination as a way of saving oneself and preserving our hospital services for other people with other more serious illnesses than ourselves.
Of course, after 2 years of low cases of influenza, we are now reporting a rise in influenza, or at least it's an influenza season. How does that impact on our strategies, or does it have any bearing at all?
Well, it's very interesting because influenza is transmitted through respiratory droplets in the same way that SARS-CoV-2 is transmitted through the respiratory droplets and aerosols. And the spike in influenza cases tells us that, by and large, affected communities with influenza are not adhering to social distancing, to mask wearing, and to improving ventilation. So, in fact, the late and unusual seasonal influenza is pointing to the need for us to watch out and to strengthen our adherence to non-pharmaceutical interventions. The good news is that influenza is transmitted and maintained in society primarily by younger persons, particularly school children, unlike SARS-CoV-2, where school children and younger age children are not as affected and certainly don't transmit SARS-CoV-2 to the same degree that they're able to transmit influenza. As a consequence, when the schools end, which is shortly, the influenza season is likely to end. However, if we don't adhere to non-pharmaceutical interventions, if we don't get vaccinated against COVID, we're very likely to see the spike of the fourth wave coming along. So, as you will have seen from the recent reports, the number of cases in Gauteng is increasing. Although the levels are still very low, it is at this early stage, and we've learned from experience now as a country and as a globe, when the infection rate starts increasing, even at very low levels, it's important. It tells us that the virus and the wave is coming. Of course, mathematical models and epidemiologists have tried to predict, and we are hoping they're right, that the fourth wave will not be as devastating as the third wave, but time will tell. And in the meantime, the only proven interventions are vaccination, mask wearing, social distancing, and ventilation.
Dr. McCarthy, I appreciate your time. Thanks for joining us, a specialist pathologist at the NICD, Dr. Kerrigan McCarthy.